Hello, my name is Macaulay Devon, and today we are going to be going over the project that I did for the Community Nutrition Project while in my pediatric rotation. I was located at Providence Pediatrics across 2 different sites, and my preceptor's name was Michelle Hagan. The project that I chose to look at was to look at social media and pediatric nutrition, the impacts it has on eating behaviors, and the role of the registered dietitian. A little bit of background is important to be able to establish the relevance and importance that this project has for today. Adolescents are currently spending about 8 to 9 hours of screen time per day, according to the American Academy of Pediatrics. This is important because this is not screen time that is associated with school, such as for assignments, homework, or exams. This is screen time that is purely in the form of media and entertainment, such as social media, YouTube, TV, and other forms. This increased screen time can increase the risk of physical inactivity, disrupted sleep patterns, and poor sleep quality, depression and anxiety symptoms, and perceived poor social, emotional, and peer support and relationships with others. Additionally, the CDC published a study that showed that each additional hour of screen time and social media usage was associated with higher odds of the fear of weight gain, engaging in compensatory behaviors to prevent weight gain, a poor self-worth related to body image, engagement in binge eating behaviors, and engagement in all disordered eating behaviors. This has very strong relevance to dietetic practice because, as we have just seen, social media influence eating and exercise behaviors, which can increase the risk for disordered eating patterns and the development of an eating disorder. This is important because RDs are uniquely qualified to address these issues because they are the trusted experts in evidence-based nutrition and patient education. It is important for us to be able to understand that patients are likely to come in with nutrition misinformation, and early intervention can prevent negative behaviors and unhealthy relationships with food. In fact, in a survey that was put out by the Academy of Nutrition and Dietetics, it was shown that nearly half of all Americans have acted on nutrition advice from social media and/or AI. And unfortunately, in one study that reviewed nutrition content on TikTok, specifically the What I Eat in a Day trend, showed that 42% of these videos were mostly or completely inaccurate, 55% lacked scientific evidence, 77% did not disclose conflict of interest or financial gain, and 90% had no discussions of the risks or benefits. Thus, it is very important for RDs to be aware of current trends, so that we can provide helpful resources to providers, caregivers, and patients. This resource should be able to promote healthy boundaries with social media and provide a positive relationship with social media and with themselves and food. It also should be able to offer alternative body neutral or body positive creators because it is unlikely that adolescents will not engage with social media at all. Therefore, if we can offer a better alternative, that could be very advantageous. The need for this project was identified through clinical observations, patient interactions, and discussions with my preceptor and other healthcare professionals at the pediatric site. This pediatric site has many healthcare providers as listed here, and they serve patients from birth to 21 years old. The primary goal and purpose for this project was to increase education for pediatric providers, patients, and families about how social media can influence nutrition information, eating behaviors, body image, and increase the risk for disordered eating, as well as promoting a positive relationship with these things. This was primarily done through the development of educational material. Data collection was done through the observation of patient appointments, collecting provider input and feedback on this project, social media research, and research that is currently being done in scientific literature. The 3 main project components of this project, as mentioned, was to look at current trends, primarily through hashtags and key search terms, through the alternative influencers, primarily through people such as dietitians, PhDs, and good, balanced personal trainers and general influencers. And lastly, through having boundary options, such as app-specific restrictions like TikTok and Instagram, a physical device called the Brick device, and other phone apps. These are the 3 project components that were actually in the resource itself. We can see that it was specifically divided into men and women specific information to be able to further address specific patients. The project implementation done through my efforts was primarily through the development of this educational resource and a discussion and explanation of this resource with my preceptor. Secondarily, after I left my rotation, I was notified that my preceptor had a lengthy discussion with the other providers at the clinics, explaining the importance of this resource and discussing its usefulness with their patients. In conclusion, this project really was to show that excessive screen time with adolescents can increase the risk of negative health behaviors and conditions. Social media strongly influences adolescent behavior, but that pediatric RDs play an important role and should have some awareness of current trends, so that we can be able to provide boundary resources that are helpful for providers, caregivers, and patients alike to be able to promote a healthy relationship with social media and food and with themselves. Here are a list of my references, and thank you so much for listening to this.